welcome to our esteemed panelists. Very happy to be here. My name is Karim Amer. I'm the head of healthcare and education coverage for Mashreq Bank. The Egyptian economy is one of the few economies globally that continue to grow. Throughout the region, investors and providers, obviously healthcare has risen in terms of priority. Investors, providers, everybody is now looking to diversify their presence and the risks and looking to, as much as possible, grow in economies such as Egypt and ones with sustainable growing population.
The interesting part, definitely from an investment point of view, definitely Egypt is one of the major focus when it comes to the healthcare. If you see all the indications, whether it's a disease indication related to the lifestyle diseases, whether it's a cardiology, oncology. So I think these are the key indicators which definitely demands for a very strong, robust healthcare infrastructure.
As Egypt is the most populous country in the Middle East and North Africa region, over 100 million people, and there are expected to be by 2050 over 150 million people in the country. And this is a huge challenge for any government, but with the life expectancy extending, with the increasing challenges of healthcare with modern lifestyles, etc., that's a lot of pressure on the government, and a huge number of additional hospitals and hospital beds are required.
We're seeing that there's regional players that are setting up manufacturing capabilities in Egypt, both to support the obviously very large and growing local market, but also to support their exports in general. So I would say that the pharma market is twofold, and that's an important point. So I think that the private insurance business is going to be very important. And then finally, a nascent but very important point, which I think can help leapfrog the Egyptian market, is on medtech.
We're looking at two things. First of all, basically digitizing the patient pathway and medical record and all of that. And that's something, and we're building that, we believe, a proprietary system that can work very well across all facilities in this country. On the health tech provision side, this is something that we've been investing in. We've invested in our own application, but we think that this is a very important part of healthcare provision going forward.
We encourage private sector providers to come forward, set up, meet the standards, the ISCO standards and the GAHAR standards, and then come to contract with us. No one can cover everyone through only the public sector. We expect, and I don't want to say demand, but we really do wish that the private sector would step up and join this journey until 2030, because governors need more hospitals and need more primary care centers. From the insurance side, we are currently discussing with the private sector insurance companies regarding how the relationship between us and them will continue.